Bismillahirrahmanirrahim. Rabbi zidni ilma. Keep your eyes on the stars and your feet on the ground. Assalamu alaikum. My name is Dr. Sadia Rafiq, and my today topic of presentation is chlamydia. Learning outlines include introduction of the topic, epidemiological determinants, mode of transmission, clinical presentations, level of prevention, and recent updates. Learning outcome. At the end of this presentation, my colleagues would be able to describe the epidemiological triad and the prevention aspects of this infection, explain the factors that contribute to its spread, and knowledge of the recent advances. Chlamydia. It is one of the most common sexually transmitted diseases, known as a silent disease because although it often has no outward symptoms, it can cause major internal damage. Treatable with antibiotics, can cause pelvic inflammatory disease, PID in women, and lead to sterility in men. Introduction. Chlamydia is a common STD that infect both men and women. It can cause serious permanent damage to the women's reproductive system. This can make it difficult or impossible for her to get pregnant later on. Chlamydia can also cause a potentially fatal ectopic pregnancy, which is a pregnancy that occurs outside the uterus. History. Chlamydia first became recognized as a specific sexually transmitted infection in 1970s, but it took until 1988 for it to become notifiable. Newly diagnosed cases were reported only routine in STS statistics from 1990, when there were 34,000 new diagnoses. The number began to rise steeply after 1995, reaching 1 lakh in 2003. Prevalence. CDC estimate that there were 4 million chlamydial infections in 2018. Chlamydia is also the most frequently reported bacterial sexually transmitted infection in the United States. However, a large number of cases are not reported because most people with chlamydia are asymptomatic and do not seek testing. It is most common among young people. 2/3 of the new chlamydia infections occur among youth age 15 to 24 years. It is estimated that 1 in 20 sexually active young women aged 14 to 24 years has chlamydia. Substantial racial/ethnic disparities in chlamydia infection exist, with prevalence among non-Hispanic blacks 5.6 times the prevalence among non-Hispanic whites. Chlamydia is also known among men who have sex with men and screen for rectal chlamydia infection. Positivity range from 3 to 10%, and for pharyngeal infection, positivity ranges from 0.5 to 2.3%. CDC statistics 2019. There were 33,725 cases of chlamydia, gonorrhea, and syphilis reported in 2019 compared to 32,024 cases in 2018. Chlamydia, the number one reported infectious disease in the state, increased by 4% to 24,535 cases in 2019. The majority occurred in teens and young adults ages 15 to 24 years. Spread by having vaginal, anal, or oral sex with someone who has chlamydia. If someone has chlamydia and was treated in the past, can still get infected again. This can happen due to unprotected sex. If someone is pregnant, she can deliver or transmit his transmission of infection to the baby during childbirth. Epidemiological triad includes agent, host, and environment. Agent. Chlamydia trachomatis, gram-negative bacteria, obligate intracellular bacteria, and lives in the cytoplasm of epithelial cell. Survive by replication that results in the death of the cell. Takes on two forms in its life cycle. First is elementary body, and second is the reticulate body. And it is obvious by the chlamydia life cycle. You can see the elementary body enters into the cell and includes, it is the elementary body for 0 to 6 hours, and then 6 to 12 hours it just increases in size and replicates in the host cell, and as the time passes the number increases. After 48 to 78 hours it ruptures and comes into the bloodstream of the host. So the disease pathogenesis due to Chlamydia trachomatis is a complicated process that involves, number one, exposure to the organism and infectivity, survival within the host cell, virulence associated with specific strain type, innate and acquired immunity, and host genetic susceptibility to infection and disease. Chlamydia family, species that causes diseases in humans. It has species and genus which is related to different diseases. The Chlamydia trachomatis has leads to causes trachoma, pelvic inflammatory disease, non-gonococcus urethritis, conjunctivitis, infant pneumonia, lymphogranuloma venosus. Then it's the Muni type and Cetacean type. It has different species which leads to different types of disease in the human beings. Chain of transmission. Reservoir is human. Risk factors are adolescence, new or multiple sex partners, history of STD infection, or the presence of another sexually transmitted disease, and lack of barrier contraception. Transmission is sexual or vertical, highly transmissible. Incubation period is 7 to 21 days. Significant asymptomatic reservoir exists in the population. Reinfection is common. Perinatal transmission results in neonatal conjunctivitis in 30 to 50% of exposed babies. Clinical features. Most people who have chlamydia have no symptoms. If have symptoms, they may not appear until several weeks. Even when chlamydia causes no symptom, it can damage the reproductive system. Chlamydia trachomatis infection in men. The first main is urethritis, one cause of non-gonococcus urethritis. It is occurs in majority, more than 50% of asymptomatic patients. If symptoms, if signs are present, it is mucoid or clear urethral discharge or dysuria. Incubation period is probably 5 to 10 days into symptomatic infection. Then the complications which it leads to in men are epididymic and Ritter syndromes. It is a family of arthritic disorders which usually involves the joints of the spine, and it rarely occurs in women. The infections in women basically include cervicitis. Majority 70 to 80% are asymptomatic. Local signs of infection when present includes mucopurulent, endocervical discharge, edematous cervical ectopy with erythema and friability, and the urethritis. Usually asymptomatic sign and symptoms when present includes dysphoria, frequency, and pyuria. It is you can see the presentation of the normal cervix of the female, and it is the chlamydia cervicitis. You can see it's how much fragile, red, erythema, and it's usually touch to bleed. Then the complications which it leads in the women are main pelvic inflammatory disease. It is through salpingitis or endometritis and the perihepatitis, which is also called Fitz-Hugh-Curtis syndrome. It is a chronic manifestation of PID and almost exclusively it is only in women. Because of the chronic PID infection, the capsule of the liver is infected and then it leads to further complications. And Ritter syndrome could be in the female, but its intensity is less as compared to men. You can see the acute salpingitis on the right side of this ovary and the fallopian tubes and the uterus. You can see the multiple adhesions due to the infections of the PID, which further leads to infertility. Then the infections in the infants. Perinatal clinical manifestations are inclusion conjunctivitis and second is the pneumonia. The pre-adolescent males and females have urogenital infections. They could have usually, they are mostly asymptomatic and there's vertical transmission from the mother to the child and it could be due to the sexual abuse. So it is the summarization of all the clinical syndromes caused by chlamydia trachomatis, men, women, and infants. In men, local infection, conjunctivitis, urethritis, prostatitis. Complications in men are Ritter syndrome and the epididymitis. And chronic sequelae could be arthritis or infertility. And in women, as same we can say conjunctivitis, urethritis, cervicitis, and proctitis. And complications, basically endometritis, salpingitis, all these have the PID, then perihepatitis and Ritter syndrome. And later on, it can lead to ectopic pregnancy, chronic pelvic pain, and chronic arthritis. And the infants, the local infections are the conjunctivitis, pneumonitis, pharyngitis, and rhinitis. And complication could be a chronic lung disease if it was in severe severity was strong or with multiple other complications. And sequel is rare. Chlamydia and HIV, untreated may increase a person's chance of acquiring or transmitting HIV, the virus that causes AIDS. Levels of prevention. Primary prevention, health promotion, specific protection. So the primary prevention includes the health promotion, includes three strategic areas: promoting public health policy, promoting a supportive environment, strengthening community action, promoting health personal behavior skills by providing information, education, and counseling, orienting health services towards meeting all the patient needs, specific health education programs regarding safe sex, using condoms, reporting for early treatment, strict compliance. All these factors prevent further transmission of disease. Health promotion includes practicing abstinence, avoiding high risk sexual behaviors such as unprotected sex or multiple sexual partners, and using latex condoms. Specific protection, no vaccine is available, but for the first time, a vaccine against chlamydia has completed a clinical phase trial 1. Secondary prevention includes early diagnosis and prompt treatment. Diagnosis. There are a number of diagnostic tests for chlamydia, including nucleic acid amplification test, NATs, cell culture, and others. Nucleic acid amplification tests are the most sensitive test and can be performed on easily obtainable specimens such as vagina swabs or urine. Urine is a specimen of choice for men. Culture can be used for rectal and pharyngeal specimen but is not widely available. NAT have demonstrated improved sensitivity and specificity compared with the culture for the detection of chlamydia trachomatis at non-genital sites. Testing techniques include culture, non-culture test, which includes nucleic acid amplification test, and non-NATs and serology. Culture. Historically, it is gold standard. Variable sensitivity from 50 to 80%. It's highly specific use in legal investigation and is not suitable for widespread screening. NATs. NATs amplify and detect organism-specific genomic or plasmid DNA or RNA. FDA cleared for urethra swab from men or women, cervical swab from men, and urine from both. The commercially available tests includes are given below: Becker and Dixon, BD Probe Tech, Gen Probe, Amplification CT, Aptima, and Roche Amplica. Significantly more sensitive than other tests. Then the non-nucleic acid amplification test includes direct fluorescent antibody test, enzyme immunoassay, and nucleic acid hybridization. Serology. It is rarely used for uncomplicated infection and because it is difficult, results are difficult to interpret. Treatment. Chlamydia can easily be cured with antibiotics. HIV positive persons with chlamydia should receive the same treatment as those who are HIV negative. Person with infection should abstain from sexual activity for 7 days after single dose antibiotic or until completion of a 7-day course of antibiotics to prevent spreading the infection out to partner. Although medication will cure the infection, it will not repair any permanent damage done by the disease. If a person's symptoms continue for more than a few days after receiving treatment, he or she should return to a healthcare provider to be re-evaluated. Infection in infants can be treated with antibiotics as well. This is the CDC guidelines regarding the treatment of the chlamydia infections, and the recommended regimes are azithromycin 1 gram orally in a single dose or doxycycline 100 mg orally twice BD for 7 days. And the alternative regimes includes erythromycin, levofloxacin, and ofloxacin. So the treatment of uncomplicated genital chlamydia infection, which I have showed you in that article. So these things are being followed. CDC recommendation: azithromycin single dose or doxycycline in BD for 7 days, and the same ofloxacin or levofloxacin can be given. Then the treatment in pregnant women. In pregnant women, we have some limitations in the uses of antibiotic due to some side effects. So the recommended doses by CDC are erythromycin 500 mg orally 4 times a day for 7 days, or amoxicillin 500 mg orally 3 times a day for 7 days. And alternative regimes are changes with the base of the erythromycin usually we take, and azithromycin 1 gram orally in a single dose can be given. And for the treatment of neonatal conjunctivitis and or pneumonia, CDC recommendations are erythromycin base of ethyl succinate 50 milligram per kg per day orally, divided into 4 days daily for 14 days. And then there is a treatment for the children, because mostly it is present in teenager from 15 to 24 years is a highly prevalent zone. So in which the children who have weight less than 45 kgs, erythromycin is calculated accordingly, then more than 45 kgs, and children more than 8 years of the age. And usually azithromycin 1 gram orally in a single dose. And if not, then doxycycline is given. Treatment of lymphogranuloma venereum, it is one of the STIs, which is also the causes chlamydial trachomatis infection. And for its treatment, the treatment is doxycycline 100 mg twice daily for 21 days. In the previous, we have seen it's being given for less time, for a week or 8 days. In this scenario, we gave for 21 days. Or alternative regime erythromycin based 500 mg 4 times a day for 21 days. So there is a difference between the duration of the medicine. Then the repeat testing after treatment. The pregnant woman repeat testing preferably by culture 3 weeks after completion of recommended therapy. And in the non-pregnant woman screened after 3 to 4 months of the treatment. Consider test of cure 3 weeks after completion of therapy for anyone treated with erythromycin. To help get partners treated quickly, healthcare providers in some states may get infected individual extra medicine or prescription to give to their sex partner. This is called expedited partner therapy or EPT. Why to screen for chlamydia? Screening can reduce the incidence of pelvic inflammatory disease by more than 50%. Most infections are asymptomatic and screening decreases the prevalence of infection in the population and reduces the transmission of disease. Screening recommendations for non-pregnant women is sexually active women aged 25 years or under should be screened annually. Repeat screening of women 3 to 4 months after treatment of infection, especially after adolescence. And for the pregnant women, screen all the pregnant women at the first prenatal visit. And if they're more than 25 years and those at increased risk of infection should be screened again in the third trimester. Partner management. Sex partner should be evaluated, tested, and treated if they had sexual contact with the patient during the 60 days preceding the onset of symptoms or diagnosis of infection. The most recent sex partner should be evaluated and treated even if the time of the last sexual contact was more than 60 days before symptoms onset of or diagnosis. Reporting. Chlamydia is a reportable STD in all states. Report cases to the local or state sexually transmitted diseases program. The prevention counseling. Nature of the infection. It is commonly asymptomatic in men and women. In women, there is increased risk of upper reproductive tract damage with reinfection. And as far as the transmission issues are concerned, effective treatment of chlamydia may reduce HIV transmission and acquisition. Abstain from sexual intercourse until partners are treated and for 7 days after single dose of azithromycin or until the completion of the 7 days regime. Risk reduction. The clinician should assess the patient's behavior change potential, discuss prevention strategy, abstinence, monogamy, condoms, limit number of sex partners, etc., and develop individualized risk reduction plans. Global and national updates. According to World Health Organization Global Health Sector Strategy on Sexually Transmitted Infection 2016 to 21 towards ending STIs. To present Global Health Sector Strategy on Sexually Transmitted Infection 2016-21 builds on conclusion from the evaluation of the implementation of the Global Strategy for the Prevention and Control of Sexually Transmitted Infection 2006 to 15 and sets out the VN goals, targets, guiding principles, and priority actions for ending the sexually transmitted infections epidemic as a public health problem. So in Pakistan, National AIDS Program was established in 1986 to 87, and it is one of the aim in the National AIDS Control Program to reduce the sexually transmitted disease transmission. And as such, there's no separate program going on for the STIs. Then it was one of the article published. The cross-section studies was conducted attending STIs clinic from July 2006 to 2009, and blood and urethral swabs were collected and tested for syphilis, gonococcus, genital herpes, chlamydia, and cancer. And out of 1532 patients were participated in this study, and mostly the infections were among the people to 30 to 45 years. And the results of the study showed the estimate of chlamydia prevalence were broadly comparable with those reported in other population-based studies, showing prevalence rate ranging from 4.1% to 5.2%. Then the chlamydia statistics by CDC and its prevalence or cost shows there is 1 in 5 people in USA have STIs, and totally near 68 million infections in 2018, 26 million new STIs in 2018. Almost half of new STIs were among youth age of 15 to 24 years of the years, and new STIs 16 million in direct medical costs. So one of the sexually transmitted disease surveillance 2018 by CDC shows the pattern of the STIs till 2018, starting from 2000 and number of the cases. You can see the women, men, and total. Men are the at the higher side. And same, it is the rates of reported cases by age group and sex. United States 2018, and you can say the age group and the male and female rate. It was maximum at the age of 20, 24, 15 to 19 females are, and rates of the reported cases among females age 15 to 44 years by age group. So the recent advances, koalas really do get chlamydia. How these marsupials could help humans battle the STIs? It is the new update in the infection. In koalas, chlamydia ravages are extreme, leading to severe inflammation, massive cysts, and scarring of the reproductive tract. In the worst cases, animals are left yelping in pain when they urinate. Because of these similarities, the vaccine trials that endeavor may have valuable clues for researchers across the globe who are developing a human vaccine. Now it's time for the multiple choice questions. Chlamydia is called the silent disease because it often goes undetected. What portion of
Affected man
and women
and women have symptoms of chlamydia.
one in two,
One in two and four
men,
in men.
three in 10 men, one in two men, one in 10 men, three in 10 men, 5 in 100 men, and one in.
D.
No, the
No,
correct
the correct answer is
C, C.
one in 10 men and three in 10 women. Question number two. Which age group has the highest
highest rate of chlamydia infection.
D.
C.
D.
D.
the
D.
correct
The correct answer is 20 to 24 years.
of every 20 sexually active adolescent girls and young women aged to 14 to 24, how many are likely to infected with chlamydia? Wrong.
Wrong.
B.
One in, I have told you that one in the 20 would have that. What serotype of chlamydia trachomatis is associated with inclusion conjunctivitis seen in aid and yes, exactly.
A.
It's serotype B because it is the same bacteria which can lead to trachoma, which leads to irreversible blindness. So D and K. Which of the following statements is not the distinguished feature of the family Calamdiceae? Number A,
Number
they are,
A, they are
C.
they are
they are
obligatory.
obligated.
C.
Right.
It's A.
Six, human is the only reservoirs of Chlamydophobia pneumoniae. The pathogen is most prevalent in which age group of people?
A.
No, it's C, 5 to 18 years. All of the statements given below are correct about pathogenic chlamydophobia pneumoniae except yes, the correct answer is A. It causes respiratory, which is most common. It's a wrong statement. When do the symptoms of neonatal pneumonia in babies start to show caused by chlamydia trachomatis?
10 days, 5 to 10 days.
No, it's B.
First
2 to
week
12
after birth.
weeks. Chlamydia trachomatis is transmitted from the infected mother to baby through birth canal, can cause neonatal conjunctivitis. After how many days the symptom starts to develop in eye?
D.
It's 7 to 15 days. I have given the clue in the question how many days. Name the organisms given below which is frequently associated with urethritis apart from Chlamydia trachomatis.
Neisseria gonorrhea.
Yes, she is right. D. Neisseria gonorrhea. This is the key, and thank you so much.